We're very pleased to have with us today one of our real experts in the way of behavioral health here in Western Massachusetts, Dr. Barry Sarvet, who's joining us from Baystate Health Services. And we are very pleased to have you on. Thanks for taking a moment or two to have a conversation with us and answer some questions I think that hopefully people watching at home might be able to get a little bit out of, because I think many people out there have similar questions that their neighbors have regarding some of the issues that we're facing with the pandemic. So first off, just wanted to give you a minute or two to talk a little bit about who you are, how you got to where you are now, and what brought you to Baystate and all those good type of things, just so people at home can kind of get a good familiarity with you right off the bat.
Thank you, Senator. And first of all, I just want to thank you for having me. I always love to have opportunities to educate the public about mental health issues, which are important to all of us. So I'm the chair of the Department of Psychiatry for Baystate Health. I've been at Baystate for 21 years, coming on 21 years now. I started out as the chief of child psychiatry here and worked, to build a child psychiatry program here for about 15 years, and then I took over for my former boss, Dr. Ben Lipson, about 5 years ago to become responsible for the overall department. I'm not a Massachusetts native. My wife is, and she was born in Lexington. But I grew up in New York and spent some of my professional time, my early career in New Mexico. And I did my training in psychiatry in Connecticut at the Yale Department of Psychiatry and the Child Study Center there. And so I'm very pleased and love, being in Western Massachusetts. I actually chose to come to Baystate because I wanted to be in Western Massachusetts, and I was looking for an academic job, as Baystate as a teaching hospital. And I was excited about the opportunity to build a child psychiatry division, because at Baystate at the time that I came, it was there wasn't really a division, that it was a very, very small number of people focused on doing child mental health work. But it's been a wonderful partnership, a wonderful relationship for me, and I've grown a lot, learned a lot here. I love the people of Western Mass. And I've been very fortunate to have the support of our health system to really build some programs. My professional interests have been in the area of integrated care, which is the relationship between mental health and primary care. And it's really related to the need to kind of take a look at the needs of the whole community and to try to improve access to care, because so many people with mental health problems don't know where to turn, and they don't know where to go, and they don't have access even if they do know where to go. And so early on in my career, I became convinced that we need to have partnerships, that mental health needs to be provided in partnership with the whole health system, and not as a separate area, which is usually under-resourced. And so we've built a lot of programs, both in children's mental health and adult mental health, to really strengthen the ability of the primary care system to be a first responder for mental health needs, and to kind of really include mental health as part of the of a patient's overall health, to include a focus on that, and to have it be part of the problem list. For every patient, has a list of diagnoses and things like that pediatricians and primary care doctors have to keep track of. And we want to make sure that the primary care doctor is including mental health on the list, along with asthma and hypertension and all the other, health conditions that they follow, and that they have the resources to be able to do something about these issues and to coordinate themselves with mental health providers. And so that's been my professional focus, in addition to overseeing all the other acute behavioral health services at Baystate and sort of all the consultation services. The other thing I would add, because I don't want to talk about myself the whole time, but one of the things I love about my department here is that we have a really wonderful group of teachers and learners, that we provide a lot of training, that we have a psychiatric residency program, and we're starting this year, this is news, that in July, we're starting a child psychiatry fellowship program, because that's been a major pain point for the region is the shortage of child psychiatrists. And so we're producing adult psychiatrists and child psychiatrists at Baystate, starting the child psychiatry starting in July, and that's been a major part of our interests as a department at Baystate Health.
Well, it's great, and we're very lucky to have you here in Western Mass. I know Baystate feels very lucky that they have you within the organization, and I think we as a community are certainly better off with you leading the charge and building the new programs, I guess, programs that for many years have been lacking, not only here in Western Massachusetts, but really everywhere. But I think as time has gone on, we've realized how critical mental health is to everyone's overall health, and especially when we talk about children. So thank you for the work that you do. And I'm sure right now is a very busy time for you, considering everything that is going on related to COVID-19 and, the shutdowns of everything and kids not being at school. And what is your just basic overall advice for a parent or anyone that is kind of, everybody's going through the same thing? How do people who maybe, it's a different time right now, so maybe people have never encountered behavioral health or mental health issues with themselves. How do people, when they're sensing something different, what's the best way to kind of deal with it?
Yeah, so I guess why don't I take a step back as a first step to talk about the kind of stress, that people are experiencing right now, and how it affects, mental health. The one thing that you said about we're all going through the same thing, or we're all in this together, that's true on one level, but it's also not totally true in the sense that that it's the circumstances we're in that are affecting people in different ways, depending upon their role. One small example of that is that, I go to work every day. I come to the hospital and I have a lot of work. I'm busier than ever at work. And I leave my house and go in every day, and I'm working alongside of people in the healthcare system who are working harder than they've ever been working before. And they're exhausted. They're putting themselves in harm's way. We've been fortunate that we really have been successful at keeping healthcare providers safe. At Baystate, by and large. But it's still, they are in harm's way. And so there is that kind of stress of the healthcare workers and the workforce and other essential workers, who are busy, and we're all, counting on them, and they have to live with a different kind of stress than those who are isolated, at home, and those who don't have income because they don't have a job, or they don't have a business, that's generating income for them. And they're not having enough opportunity to see people and to interact with people. So I wouldn't say, that any one kind of stress is worse than the other. It's just different. But I think that there's lots of different stories of the kinds of hardships that people are experiencing with different kinds of mental health impact. And so when it comes to people in the community, I think that probably the majority of people in the community are experiencing a lot of stress related to social isolation, related to loneliness, and inability to participate in the community, in the way that they had before, whether it's going to church or other kinds of religious services, engaging with their family members. So there's that, which I wouldn't say is necessarily a traumatic stress, but it's a pretty serious hardship, and it does increase the risk for depression, as well as other kinds of mental health issues. Almost every psychiatric illness that we know of is influenced by stress. It's not necessarily caused by stress. The only psychiatric illness that is truly caused by stress is post-traumatic stress disorder. All the other ones, whether it's depression, anxiety, all the different kinds of chronic mental illnesses, can be influenced by stress, and the course of the diseases are worsened by stress. And also the severity of the diseases, and then some of the diseases and conditions can be triggered by stress. It's not the stress is necessarily the reason why they have the condition, but it's the trigger, or it's kind of the immediate cause of why it's happening right now. And so loneliness, I think, is a big one. Then there's fear of getting sick, because we are all living, under this condition of knowing that there's this deadly disease that is in our community, and that we all have to protect ourselves and do everything we can to protect ourselves and others against it. But we also have to admit our powerlessness to absolutely prevent ourselves and our loved ones from getting this disease. And so that condition of living with the uncertainty is a very big stressor when it comes to people's day-to-day lives. And so there's others. I mean, there's the issue about people with substance use disorders. I've talked about this in the media a little bit, but there's a very heightened risk of people who are grappling with substance use disorders to have a relapse and have a recurrence, under the conditions of isolation, boredom, kind of just self-medicating, all the anxiety that people are experiencing, the fact that support systems aren't in place to help to maintain recovery for people with substance use disorders in the same way. It's not as if they don't exist. The support systems do exist, but they're not the same, and it's hard for people to make the transition to all the online sources of support that people usually have access to support their recovery.
It's very, very interesting. A lot of different components that you have to think about. So I appreciate and thank you for all the hard work you're doing. And you mentioned isolation, and those of us with children, school age kids, obviously, the one thing that we think about quite a bit is, the kids, your children aren't seeing their friends every day. They're not going to school. They're not having that social interaction with their peers that they normally do. Of course, they can go outside. Hopefully there's neighborhood kids that they can interact with. So it's a little bit different, but not everybody's in that same type of situation where they have neighbors, or they have neighbors with school age kids. So what advice could you give to parents that, I know and I'll just use myself as an example, our house as an example, is, when we first started with this, obviously, staying inside was paramount, right? And, one thing obviously we notice very quickly is that when the kids are inside, as much as they are, they play a lot of video games. And the video games, we've always tried to, limit the time that our kids spend on the video games. But at the same time, nowadays, that's how they socialize with each other in some respects, because they, go on Xbox or whatever the system is, and can kind of find their friends and interact with their friends. What advice do you have for parents that are worried about their kids getting way too much screen time these days?
That's a good point, Senator. Everybody is using screens, more these days than would be ideal. I didn't mention this, and I wanted to make sure I get this in. Is that mental health services are alive and well, right now. I mean, everyone's worried about their kind of financial health, in the healthcare sector, including mental health. But business is we're open for business in behavioral health, because everyone is doing, all the mental health providers are doing virtual mental health care. And actually, we've learned that virtual mental health care is perfectly acceptable. It's been really quite wonderful to see, because there are lots of advantages to virtual mental health care to bridge access barriers, particularly geographic access barriers to care. But I only mention this because, mental health providers are sitting in front of a screen all day, doing their work. And people who have administrative roles in the healthcare system are, in meetings, for lots of time of their day, in front of a screen. And so I think the biggest problem with screen time is the inactivity, the physical inactivity. And kids, especially younger kids, but older kids, everybody, adults as well, we need to be moving around, that our bodies do not respond well to being seated or even, standing in one place, for hours at a time. And people go into these like zones with their video games where they might not sort of stand up or move, for hours at a time, because it's so engaging, and so I think parents, on the one hand, have to be realistic, and also have to be kind to themselves too, that parents don't have time to organize activities for their kids all day long. And so there is this issue about the TV and the computer being almost like a babysitter in a sense, which, we want parents not to feel guilty about that, because it's just, parents have to be realistic, that they have lots of responsibilities. And so I do think it's fine for parents to lighten up a little bit with, the standard kinds of screen time limitations that they might have. But that said, I think that we need to get our kids moving, and sadly, not all kids have access, as you mentioned, to being able to go out and play. That some kids in our communities around in our area don't have safe neighborhoods, where it's safe for them to run outside and call on their friends and play outside without adult supervision. And so that's a hardship, but I think that people have to be creative, about, kind of giving kids some advice and helping them and really empowering them to do some play. So kids need to play, they need to move. Parents may need to help to structure that or provide them with some ideas and resources to do that. Cooking, it's not a physical exercise, but kids can do all kinds of things. They can help with things more than we give them credit for, and we can get them involved in household activities. We can gamify chores, and I think it takes creativity. It takes time. We can't do it all day, but I think parents, do need to try to do that as much as they can. The other point is structure. That when people are home all the time and you don't have, sort of your, you have to make it to the bus stop, to get picked up to go to school at a certain time, then, things start to kind of drift, in terms of schedules, that kids start sleeping in, parents are sleeping sleeping in. Times for meals are kind of shifting around. Bedtime seems to get pushed out farther and farther because it's not sort of tethered to the rhythms of a normal day that's kind of anchored by work and school schedules. So that's a problem. And so it really is not good for sleep. We have a term we call sleep hygiene, which has to do with kind of the structure and the scheduled and the sort of regularity of sleep behaviors. And so sleep hygiene, when that goes out the window, it has impacts on both physical and mental health. That when you don't have a regular time to go to sleep, and it should be synchronized to activities and to daylight, as best as possible. Some people have to work night shifts and you can't do that, but I think that by and large, most people do better when they sleep at night and they're up during the day, and they go to bed at a regular time and they get up at a regular time. And so I strongly recommend that parents do the work to set up schedules for their kids, including meals, bedtime, activity time, screen time, and then to sort of enforce that in their families and to try to help kids to have some regularity to their schedule. And all the effort that you put into that will come back to you with dividends, with your kids being happier and easier to deal with in terms of them not being irritable and frustrated and hyperactive. Because when kids are cooped up, they get all those things. They become hyperactive, they become sort of temperamental, they become anxious, and then the whole family can sort of be stressed a lot more than is necessary. And sometimes it sort of goes back to the simple things like sleep, meals, and schedules.
Absolutely. It's not easy to do. So to keep the structure in place as things have been turned on their head. So I know many families are struggling with that, but at the same time, I think it's important to let them know that everyone is under the same challenges. It affects people differently, but and as you said, parents have to be realistic about their own. Don't be too hard on themselves in terms of being the perfect teacher, the perfect arts and craft instructor, the perfect person to set up the games outside. It's parents need to, yes, be involved, of course, but it is a challenging time. So it's important to know that they need to cut themselves a little bit of a break sometimes as well. So with that said, I mean, in terms of, and you had mentioned you're open for business. It's obviously it's a time where people, I think, are seeking services of all different kinds in the healthcare world. And as we've mentioned before, healthcare, mental health care, and physical health care, or physical health and mental health, go hand in hand, and one feeds the other and can help the other, and if you ignore one, the other might pop up as well. So what, for people who might be watching, maybe they've never sought out professional help before, what are some good resources that people at home could, if they're looking either for themselves, a spouse, a loved one, a parent, or maybe their child, or they're just interested in looking? What are some good resources to look at?
Well, in terms of there are lots of consumer oriented online sources of information about mental health. And I think one of the best ones is from the National Institute of Mental Health. There's kind of an online site with lots of information. I think you would just simply Google NIMH and then put information about depression, information about anxiety, information about substance use disorders, or whatever the topic, and those articles are very consumer oriented and very user friendly. The Mayo Clinic website is also a good go-to online resource. I think that said, mental health tends to be really complicated, and I sort of hesitate to. I encourage people to read about everything they can, but I hesitate to imply that that's enough, because there are so many exceptions and there are so many issues that masquerade as one thing and turn out being something else. And so I think it's helpful to have like a human connection to get started and to begin to talk to someone who can sort of sort out what's going on for a person without having to sort of do the self-directed thing exclusively. So in addition but not instead, that I always encourage people to read and become empowered on their own, in terms of getting the information that they need. So as I mentioned before, I think that the primary care provider is a good first stop. I can't guarantee that every primary care provider is going to be equally able and interested in helping with a mental health problem, but at least within Baystate, both in our health centers and in our community practices, that we have integrated behavioral health. So the primary care providers are interested and they have resources to be able to help people to sort out, what it is that's going on, and to try to get them the help that they need, either within the practice or through referrals that are kind of more individualized referrals, as opposed to just people using the yellow pages, to find them. In addition, we have a robust community, mental health system that there's a number of large and really well-resourced agencies that provide mental health care, who people can access directly. They don't need a referral from anyone. They can simply call these organizations. The Baystate outpatient services are really limited to kind of care that's coordinated through the primary care provider or through specialty providers for people with medically complex circumstances. And this is particularly on the outpatient side. But the community behavioral health organizations like the Behavioral Health Network and the Center for Human Development, both of those organizations have intake staff. They have walk-in centers. People can call those agencies and get help right away and have some crisis response if they need it as well.
Well, it's all very good advice, and I know, as you said, a very complicated situation, mental health in general, dealing with mental health, but at the same time, with the current circumstances that we're in, it's just challenging times for many people. And we got about a minute or so left with the segment, and just wanted to maybe if you wanted to just give a little bit of I guess I don't want to say advice, but for anybody who's watching, what's a important thing for them to keep in mind as we start to hopefully transition from the lockdown, so to speak, to a little bit more freedom and businesses opening up and different things opening up. What are some things? I mean, is there any advice you can give to people as that transition starts to happen?
Yeah, I think that people need to educate themselves about the risks of different kinds of activities. And I think in Massachusetts, we're doing a much better job than other states at giving guidance to our citizens. But even here, I think in general that we have a very intelligent, whether people are educated or not, that we have a lot of very intelligent people in our community who have the ability to make their own judgments about what's safe and what's not, if they inform themselves about the things that are reasonable to do to protect themselves and to protect others. And so I encourage everyone to educate themselves as much as possible, and to control what you can control. That there's lots of things that we can control, but there are lots of things that we can control. That we're all living in a dangerous time, and we need to kind of help encourage everyone to take the measures that they can take to reduce the risk the contagion, and so this has to do with social distancing. Whether or not you're allowed to go to a certain place doesn't necessarily mean it's a great idea, to go to a place, and whether you have to wear a mask or you don't have to wear a mask, it doesn't mean it's a great idea to not wear a mask. That people really ought to do everything they can to control the risk factors that they can control. Realizing that everyone has to be realistic and that we have to do the best we can to live our lives. And so I think that we have to balance those things. And so it really comes down to controlling what you can control and accepting that you can't control everything and doing the best you can to accept that and to be kind to yourself as well, as far as knowing that you can only do the best that you can do.
Well, it's great advice. And again, we really appreciate the work that you're doing in Baystate and all of our other health professionals across Western Massachusetts, doing the best you can to deliver services in such a heavy time of need. So I want to thank you again, Doctor, for coming on and just taking a few minutes to answer some questions. I think it will be helpful for those watching that, to know that as much as you said, we're in it together, but it affects what's happening is affecting, whether it's isolation or anything else, it affects people in different ways. So I think the advice and the comments that you made are just great for people to hear. So Dr. Barry Sarvet from Baystate Health, we really appreciate you coming on, and thank you for taking the time. Keep up the good work, and hopefully we'll talk to you soon.
Thank you so much for your leadership, Senator Welch, and thanks for having me. It's been a great opportunity.
Sounds great. Take care now.